Hello, Dr. Aman. Welcome to our podcast DHIL or Digital Health Innovations for Long Life. The purpose of this podcast is broadly to understand your life course, also your ideas on what is digital health, how it can be envisioned, and how it can be achieved, and to also figure out how do we teach these new ideas to our students. So I'll briefly give an introduction of yourself, and then we can start all the way from the beginning when you are born and then slowly trace your life forward. Dr. Aman is a scientist, he is an entrepreneur, and he is also an investor who is currently advising the investment committee at SoftBank on biohealth ventures. And he is also serving as a partner at Mendel Partners, a venture built or a venture that is supporting companies that are focused on rare diseases and advanced therapies. He has contributed to numerous inventions, ventures, and successful exits in the bio and tech sectors. And Dr. Aman has also received the prestigious Johnson and Johnson Grand Prize. He is deeply committed to leveraging data to automate health services, developing technologies to address major challenges facing humanity and the planet. The first time I met Dr. Aman, I think, was during the COVID times, where the government has set up task force to evaluate several proposals that are coming from citizen startup companies on a lot of things that we can do to manage COVID. I was part of the digital health committee, and Dr. Aman was part of the life sciences group evaluating all the new ideas that are being floated around. And I think he was also very gracious to consider our own work and give us a term sheet valuing our company at a few $1 million, I guess. Well, we didn't follow up, but I guess we remained as good friends. Uh, and that was almost, I think, 5 years ago or something. So, to know more about Dr. Aman, let's start all the way from the beginning. Dr. Aman, when and where were you born?
Great. Thank you so much, Dr. Suresh. And yes, it's been a nice long journey knowing you and seeing your work and how you've evolved. And great, really, we've come to this podcast to talk about digital health. So, yeah, my journey, I'm born to parents, both of whom are, teacher professors. My father has been a professor for organic chemistry at IIT Kanpur. I was born in actually France, so I'm not born in India. So I was born in Montpellier, France. I was there for 10 months, where my father was, lecturer teacher at University of Montpellier. Then he moved over to India to come back and serve the nation. And so majority of my childhood was in the beautiful campus of IIT Kanpur, and I think that those formative years were very crucial in sort of shaping, my future in terms of really being embedded in the seat of innovation of academia and research, and networking, meeting as a young kid all these bright IIT students, learning from them and all that was definitely must have had a good impact on me, which is why I think I pursued a career also in science and innovation. And so after IIT Kanpur, we moved to Hyderabad, and my father moved from academia to industry, and then it was
Dr.
also big.
Aman, year was this? So, which years you are at IIT Kanpur? Where did you go to school? If you can put a year to this as reference, it would be really good.
Sure, absolutely. So in IIT Kanpur, I joined, Kendriya Vidyalaya, the central government school. It's we all know about it. After that, for I think 3 years, I was in a private school just outside the campus. And the years, I would say, till year 2000, we were in IIT Kanpur. I was in IIT Kanpur. And it was in the year 2000 when we moved to Hyderabad, and my parents still are there. I travel obviously between Hyderabad, Canada, and UK. And yeah, so year 2000 was when I finished my class 12th, and I was sort of very clear to pursue sciences. I mean, of course, after the being embedded in the ecosystem of science through my formative years, it was quite obvious I would not go into commerce. Although now I moved into investing, which I'll come to later, why I do what I do. But yeah. So in 2001, I had a great opportunity to join St. Stephen's College in Delhi University. And as you may know, the Stevens is one of the most premier institutions of the country, having produced a lot of great leaders, chief ministers, prime ministers, in fact, also. Uh, and again, phenomenal experience there. And while I was there, I spent about 4 months as a junior research fellow at IISc Bangalore in the lab of Professor Balram, where I got exposed to the field of biophysics. And that's where I realized how we should not look at fields in silos, right? So if you're doing chemistry, it's not just pure chemistry you do. It's If you're doing biology, it's not just pure biology. And if you're doing physics, you're not just doing physics. That's where I got the first, I would say, seed in my head that there could be interdisciplinary kind of way of doing things. And um, got a great experience for over 3 months as a junior research fellow in Professor Balram's lab. And then I came back and I got through NCBS in Bangalore as well after my undergraduate for an integrated master PhD. But at the same time, I also got an offer for an integrated master's PhD from University of Oxford and to study chemical biology. So, it was a very exciting time in my career. And so in 2004, I moved to Oxford and joined the lab of Professor Christopher Schofield, who is happens to be in the same lineage as the famous Alexander Fleming, because Alexander Fleming, after the discovery of penicillin, he opened up a whole area of research in antibiotics, and all his postdocs and all his students over the next few decades happened to be in that space. So I joined a very legacy project during my PhD called the biosynthesis of clavulanic acid. Clavulanic acid is now one of the most widely prescribed antibiotics, and my academic work was to effectively synthesize this antibiotics using enzymes. So it was a very interdisciplinary work again, training into chemistry and then eventually doing a lot of biology, a lot of biophysics, using infrared and X-ray for solving protein structures. So that kept developing my interest towards the translational side of things, right? So far it was all very academic, exposure to chemistry, biology, the interface. But then I saw that, at that time, the human genome got decoded. It was year 2000, 2004, right? The human genome decoding also opened up a lot of opportunity for developing drugs for various diseases. And that was also the era that a lot of biotech companies started coming up in US and UK and Europe, the global north. So I got very drawn to that space, after learning so much about chemistry, biology, and physics, and all of that. I really wanted to work for biotech company basically. So that was in year 2008 when I finished my PhD. I was actually only 24, so I was one of the youngest, probably the youngest PhD at Oxford from South Asia. And at that time, all the big consulting groups were also coming, McKinsey and BCG, because they want, scientific brains to solve their corporate problems. But I decided not to, pursue that route initially. I thought I'll get some experience in biotech. So, 2008, 2010, I joined this company called Astex Pharmaceuticals, and Astex at that time was a spin out of University of Cambridge, and the founders were all from GSK, and it was, I would say, the poster child of biotech at that time because it opened up a whole new way of uh, discovering drugs. The technology we were using used very high precision, high-end X-ray crystallography. So I myself was fortunate to work on a project that became now is a drug that is curing cancer. So I was the lead structural biologist, and for the viewers, I don't know if you know that developing any drug and getting it successful is one of the toughest things on the planet. And so I'm quite blessed that the three projects I was working on, one of them has now become out to become a successful cancer drug. And so yeah, so sorry, am I going off, Dr. Suresh? Should I pause, or do you have
Not
questions?
at all, Dr. Aman. I think you're just about going on the right track.
Okay.
Interestingly, there are some parallel tracks also. I was also in Oxford between 2003 to 6.
Yes,
Although we haven't actually met.
met
And
that.
I also had a similar experience where, these big consulting companies were hiring, and I went to central London, that city back Canary Wharf area,
Right,
where when
right.
I actually went to an interview, the first thing I was told is, please do go and get yourself a suit. I didn't take up on their offer though, but I think, well, in hindsight, it was still good. No regrets
Yeah,
about that.
right.
But it's wonderful to know how you started off, your childhood in a wonderful campus like IIT Kanpur, and then you went to IISc where you had this idea on interdisciplinary sciences, and then from there, when you went to Oxford, interdisciplinary sciences, along with now what is called as translational science, is essentially what kind of creates this pathway of an idea being developed and then actually reaching the market. And as you have gone through the experience, which is in some ways rare, but it is also a very fulfilling one to have, which is seeing some of the work that you do in a lab actually reaching the people and
Correct.
also being widely used. So you are right on track. So we'd really like to hear more of your experience and how you kept on adding new ideas and then transforming yourself as you keep going. Please do continue.
Yeah, great. Thank you, Dr. Suresh. And it's obviously amazing to see how scientists do get hunted by, the big corporates. I've been hunted now. I'll be honest. As I'm now, I come to where I am now. But
Are you the hunted guy, Dr. Aman, or have you become the hunter by joining these VC firms?
that's a very good point. I think I am more of a hunter. It's my choice. I'll come to it in a bit so that there is flow in the conversation.
Yes,
But
please.
yes, so yeah, so at Astex, Dr. Suresh, I was blessed because that organization was really well respected in our in sort of the pharmaceutical circles, and we had funding from all the top VCs. All major pharma companies had partnerships with us. So within a year, our company got acquired, and we got listed on the New York Stock Exchange. And within that sort of in 3 years, we also got acquired by Otsuka Holdings, the Japanese pharma company, for under $1 billion. So in 3 years, we had one acquisition, public listing, and one very large acquisition of about $1 billion that happened. And the CEO was a scientist, like you and me, right? And he also had a dream of translating his idea from lab to market and lab to patients. And seeing him succeed in this way was a huge learning experience for me. You know, because people always, even now, think that scientists cannot be commercial leaders. The scientists will always only invent and publish papers. But how he started off as a CEO, stepped down as a CEO, became a CSO, and later an experienced person become a CEO. All of these were learning things for me that as an entrepreneur you need to have that level of humility, that your invention doesn't mean that you will be always in the seat of power. You should allow others who have more experience to, you know, take things forward. Because at the end of the day, the company and your mission is bigger than you as you know, as self, right? Um, and
Absolutely.
and that was and that was a big learning for me. So anyway, so after the acquisition, besides all of us getting a little rich for sure, I took a bit of an interesting career move, and this is where my destiny kind of changed, my career changed, where I had an idea of my own, which I wanted to pursue in the same drug discovery space. And I moved over to Structural Genomics Consortium in Toronto to test out that idea. I reached out to UCSF, Novartis, a few other organizations, but they didn't have the means to incubate ideas like mine. While SGC, Structural Genomics Consortium, they were all open to trying out something like this. Also, because Astex was a success story, so all of us were all seen as, almost like stars to, whatever we can do, we'll do well. So so in 2012, right, roughly around 2012, moved to SGC and started working on this concept, which became my own first startup called Proteorex Therapeutics. And that journey, I won't go into details in the interest of time, but like from literally from bootstrapping to struggling for 6 months, raising funding, trying to explain my idea to investors, trying to get a team together, like a founding team, when you have no money. How do you, get the best talent was very difficult. But there was a big moment in 2000, I think it was 2015, where I won an award offered by Johnson and Johnson um, for the innovation that I was doing, and I, as in the company, was doing, and that changed the whole course of my first startup. So we not only won the award, we got funding from them, we got lab space, we got some of the best executives from Johnson and Johnson become my mentors, and suddenly there was a huge flurry of activities in Toronto, because Toronto at that time wasn't really big innovation ecosystem. It was there, but it wasn't fully mature as Boston or Cambridge or London or something. So, they immediately set up labs called J Labs in Toronto, and we were the very first tenants of that, J Labs. And after that, we were just inundated by investors wanting to invest in the company. We raised funding. We set up an office in San Francisco to expand on some of the tech and AI components of our drug design. And then in 2017, we had an offer for licensing of our technology, because our lead candidate, which we were developing for treating a very rare disease called mixed lineage leukemia, unfortunately, it failed preclinical studies. So, and we were strapped on cash. We could not raise larger funding. But more than anything for me, it was a phenomenal first experience of building a venture. So we ended up exiting the company to this Montreal-based biotech, and again, it was not about the money. It was more about sort of the validation of that. Our technology is still good, and someone wants it, and that was a great experience to go through. I, by that time, had become more than a scientist, as you can imagine, because I was negotiating multi-million-dollar deals in parallel as our preclinical trials were going on. Working with lawyers, financiers. A lot of that exposure I really value and cherish. And later, obviously, I got invited a lot to give talks on how to transition from science to boardroom all over Canada and US also. And I just saw that there was a big gap, right? I mean, there was a lot of postdocs who had ideas and they wanted to build companies, but they just didn't have the the know-how of how to spin out ventures and run it properly like a business, not like a academic project. And there's a big gap there, right? Running something as an academic project or running something as a business. So in around that time, I then got pulled in by Canada's largest healthcare investment bank to do what I did with Proteorex, my first startup. They wanted me to build out a few more companies with technologies coming from labs in Canada. And I ended up helping out building two companies. One is called Triumvira, which is still running and has raised more than 100 million now by financing. And then the other one's called Grey Wolf Animal Health. And I acted as an interim chief operating officer there. And the company is now listed on Toronto Stock Exchange. So this was all done by 2017, 2018. So as you can imagine, at a very young age, transitioning from academia to biotech to commercial, it was a very heady journey, right? Like it was a lot that was happening, a lot of learning was happening, and so in 2018, I was also the time when I got interested on the digital side of things, right? So the AI and analytics and all of that, and I started talking to a lot of people to learn more about that space. And in 2018-19, I kind of moved back to India, also to sort of see what can be done in this space in India, and and just to sort of you know also India offers massive opportunity for development, as we all know, right? And my narrative is still like how technology can still be used to enhance the lives of people here, which is happening, but not uh, not in the way it should be in terms of the pace, in terms of the innovation. Um, but I'll pause here, Dr. Suresh. I mean, I know I've been going on in a monologue, so if you have any questions, I'll answer.
Well, it's been really interesting to listen to the monologue with all the experiences that you have gone through. But maybe we'll just take a pause with your career, but know a little bit more about your personal self. You have traveled a lot, so any cities or countries that you really like, any cuisine that you really like, and since we are also talking about digital, we also belong to a generation where at some point in time we used a telephone that actually rang and we had to go and pick and now we have transitioned into mobile phones. So just a few things about which country you like to travel, which food you really like to eat, uh, which was your first mobile phone.
So my first mobile phone is the easy one. I think for a lot of people it was Nokia 3310. That small little you know I miss those phones because it's simple. Now it's so much complication in these phones.
So, which country do you like to travel, and any particular liking for the cuisine?
Yeah, and you'll be surprised to hear this. For a lot of people, it might be Switzerland and whatnot. For me, it's actually India. So I love to travel to the Himalayas. So I have a home there in the Himalayas with a friend. I invite you also if ever you want to take a break. Please visit us in the Himalayan home. And I love the cuisine there. So I love the Pahadi food as they call it, right? So the rajma, the local rice, the vegetables, the spinach you get there is very different, and you feel very energized eating that food. So yeah, so I would say I love traveling in India. I love Kerala as well quite a lot. I like Idiki. I like the south. But for me, my best place is the Himalayas. Yeah.
That sounds great, Dr. Aman. I would partly agree because I traveled through almost like 29 states in the country. So, yes, India
Yeah,
is
you do.
great diversity. And the Himalayas,
Yeah.
foothills, fantastic. But food-wise, I will
Mm.
stick to the South Indian, Tamil, Telugu. Kerala food is fantastic. I mean, the variety
Kerala food
and
is good.
it's really
Yeah.
great. Yes, I mean, I think I also went through a similar experience with this Nokia phones. Uh, any thoughts about your first bike, first car?
Um, First car I think was this tiny one in Cambridge, UK. I had called Peugeot 206. It was a tiny dabba car, like the Alto of India. Uh, and but I should not make fun of it because I did close to 20 trips between Cambridge and Oxford. Not 20, probably more. I think probably about 30, 40 trips and back and forth, Cambridge, Oxford, and it never broke down. It never gave me any problems. And yeah, so
Wow. Yeah, I think Peugeot and Renault small cars are like really popular in UK.
yeah, very, very good.
Okay. Well, I think we briefly took a detour about your personal likings. So going back to the career part, so what happens from 2018? I think that's where we paused. 2018, 2019, you're back in India.
So yeah, starting from 2018, I saw an opportunity after having spent close to about 14 years abroad, as many would say, the Vanvas of Ram. I wanted to come back to India and see what can be done here in terms of using technology for developing the country, right? And so, to that effect, I was involved with a bunch of LPs across, the Middle East and US in setting up of a small fund to invest primarily in AI and tech related ventures in healthcare, and with a huge focus on India. And as luck would have it, the lead investor, pulled out, and we were sort of left basically wondering whether we can still go ahead. But at that time, I had already spent a lot of time talking to more than 120, startups in India, and honestly, the level of innovation we were looking for, wasn't there. So a lot of my conversations ended up being more around, giving ideas than actually getting them funded. And as you would know, as an entrepreneur, right, you don't want to just keep getting advice; you want money. So at that point, sort of, we decided to exit the India chapter. So by 2018, 2019, we slowly sort of tapered out. um, with respect to our conversation and the term sheet and all, I mean, I think we saw value in you mostly than the actual approach. And well, as luck would have it, we couldn't really pursue that. But having said that, then I also saw an opportunity to develop a startup of my own here in India, which was going to be challenging because I've spent 14 years abroad, and coming back and working in the Indian culture, Indian system wasn't easy. So this was an idea where we were going to use saliva to track chronic diseases, so like diabetes, thyroid, cardiovascular markers in the saliva, epigenetic markers in the saliva. So I had partnered with a lab here in Chennai called Xcode, and we had got the technology to a great stage, and we rolled out the pilot also, and towards the end of 2019. And again, as luck would have it, COVID hit, and we had to really kind of you know um, uh, shut shop, if you may, right? We kind of paused it, but then really there was no demand for this kind of healthcare, right? People were very focused on saving their lives and being, careful with COVID and whatnot. And then also the health and safety issues that we as a company faced in getting saliva samples from individuals in the time of a pandemic was not the right thing to do. So the technology is still there. It's just shelved. And then that was the time in 2020, I think, is when we met, and I joined the task force along with you, and we sort of started, suggesting ideas for the government, how to go about things and whatnot. And then towards the end of the pandemic, I got an offer to build out a pharma company in India that would compete with the Chinese technologies by, disruptive innovation. And it was sort of funded by a very large group called the INCO Group. So I was very clear that this is not the area I want to be in long term, but I thought I'll help set it up for them. And anyways, it was pandemic. I was stuck in India, and I thought it will be a good time to just set up this company. And we did what we did, and we invented really good technologies over a course of sort of 18 months and whatnot. And the company after that has been sort of operating independently. And so very recently, I then got back into the investment shoes and joined the SoftBank Group as an investment advisor, and also joined a group in London called Mendel Partners that also is looking to help early stage biotechs focused on rare diseases and advanced therapies, build out their inventions into companies and bring their solutions to patients. And so very enriching last 6 years. A little bit of turbulence, primarily due to COVID, but a lot of learning, I would say. And moving forward, if you ask me, what the next 10 years would look like, I mean, I myself am working on a lot of moonshot projects, ideas in across various areas, and let's see how this all pans out.
Well, so far it's been an incredible experience, and I'm sure that you'll make it even more incredible as time goes by. Uh, just a few kind of maybe points to highlight. You kind of work through this what you call idea of identifying markers in saliva. How good it is? I mean, like you said, the project was shelved. Is it maybe I think it's the right time to have a relook at it, because now there is ideas about this longevity. People are actually taking samples, not just of saliva, stool samples, and all bodily fluids, I guess, and then understand the proteins and also the microbes in that. So I think it would be a good time to maybe have a relook at it. But as you mentioned, we also had a brief discussion about uh, this idea of imaging and then understanding the human body. In fact, like now we are planning to reposition this more in the space of longevity, where it's not just necessary to understand the person, but also the microbial ecosystem around where this person actually lives. So when you look at these not rare diseases but rare microorganisms which potentially can harm you, the way that we are trying to approach is first, can we quickly document the so called known and regular microorganisms instead of looking at the so called unusual microorganisms which could potentially uh, do harm. But we know about that they can do harm only after they go through a cycle where they affect human beings. Unfortunately, some of them die, and then we know that there is something that is harmful. So, on the inverse side, what we are thinking is if we can maybe quickly collect some samples on a regular basis wherever we are living, and then keep track of the normal ones, and if anything abnormal comes up, then automatically it becomes a cause to flag it up. And then if it causes harm, then at least we would have shortened the time to understand it, because we have already flagged it and started studying. So this again a thought process that we are trying to kind of work on, which is more of documenting normality first, and then creating a benchmark where abnormality can actually show up. So I think that's some area that we could potentially discuss. But all these things would depend on time, money, and the resources that is required to even so-called regularly document normality. There's also a Japanese so-called quality control technique, which is called as I think call and shout or something, where every train driver, even if something everything is normal, just basically calls and says everything is normal, so that if anything abnormal is there, there's still a documentation of normal. So we are trying to bring that to not just human body, where when you are trying to document the human body through imaging and say everything is normal. So I think there is a value in identifying and documenting normality in and around the human being, so that we understand what is abnormality at the shortest time interval when it actually shows up. So this is where I think digital health, the ecosystem, as in One Health, and also the microbial side of the healthcare and the organisms and the rare diseases could all be brought onto maybe one big platform, which with all the processing power and the intelligence that is showing up on the digital health side, can potentially give you idea on how normal you are presently and how normal life could be continued as much as possible. So again, ideas that we can maybe think about. But how do you think digital health is an idea, or what's your vision of digital health, Dr. Aman?
Yeah, absolutely. So, I mean, it's a very, it's a very broad and a visionary, I would say, question. I think when we talk about digital and health, I go down to the level of DNA and atoms, right? So, if we are successful in sort of almost annotating every aspect of health, which starts from diagnostic data, which really looks at your proteins and your DNA and whatnot, whether it's genetic testing, whether it's macromolecule testing like proteins and antibodies, to things like the process side of things, which is operations during the care process in a hospital or in a clinic. Um, and if you can stitch it all up, right, in a very seamless manner, then what that creates is a unified system, and that unified system is able to then be so efficient that the care process becomes seamless. There will be better health outcomes. There's greater efficiency in the system, and the way you would do it is by, right now everything is in silos, right? We all know that the data is all in silos, different departments, different labs. Imagine if you're able to get all of them to work together. And the only way I feel that one can do that is by annotating the data, making sure it's clean, processing it in such ways that it's all it's all standardized basically, right? And it's the standardization that we are missing right now, right? So even if you talk about health ID is step one, right? So what after health ID? After health ID is the actual, how do you standardize the care for that patient, their journey? So for me, the collation of all these data points in a standardized manner, annotated, cleaned, so that a patient or an individual's journey, health journey, can be tracked through their lifetime, while also ensuring the process is seamless, all the way through general consultations to uh, prescription tracking to follow-ups to IPD to OPD to insurance. And it's a huge task, but it can be done, right? I mean, and it's not being done anywhere in the world. So if India can really prove it somewhere, that is really the holy grail of digital health for me. Yeah.
Oh, that sounds a great vision, Dr. Aman. In fact, like all the things that you mentioned are, number one, potentially doable, but it's not just happening, and there are several reasons to it. It looks very easy to think that a person is walking into a clinic or a hospital, and then he's going through this journey within the hospital itself, and then we need to collect data or document whatever is his journey or interactions in the hospital. But again, as you rightly mentioned, there are challenges with regard to how we can do and the standards on how we can excuse me, collect the data. Just a second. And also, as you rightly mentioned, it's not just collecting data, it has to be so-called semantic or computer understandable, which is where this a huge layer of annotation actually comes in, and that makes the whole thing very complicated. Not complicated, but also time consuming, I should say, because if you, let's say, collect voice data or maybe image data, it needs to be at the moment converted into text data. There are some techniques which try to automate, but in healthcare you need to have extreme reliability. We are not talking about 70%, 80% here. We are talking about upwards of 99%. Even 1% means that, 1 out of 100 patients we are doing something intentionally wrong, and that's not actually acceptable. And that kind of reliability as of now does not exist, as you rightly mentioned, anywhere in the world. So I think this is where the gap is, where everything looks doable, but they are not doable at a clinical level, because a lot of these things are not reliable at up to 99.99%, which is actually what is required. So this is also where digital systems, although they hold a lot of promise with regard to scalability, are a bit lagging behind with regard to drugs, medications, because they are relatively 99.99% reliable in most of the population. Of course, there are adverse effects. They are definitely not in 1% range at all. They are in minor percentages. Uh, but there are still a lot of digital services that are being rolled out. So, in your opinion, what do you think are the best services that are available in the space of digital health? Now that you have mentioned, you've spoken to several startups, and then there are a lot of people offering different services in digital health.
So I've not followed up on this particular technology, but when I met this startup I think it was like 4, 5 years ago, I found it quite impressive. So this was a startup that was using the doctor had they would write the prescription. The prescription would convert the handwriting into digital, and it would go straight to the pharmacy. And so it was basically the fastest way of getting a prescription to the pharmacy, and that also ensured that within the competitive space of e-pharmacy, their technology allows for their pharmacy to be more successful, right? So it was some pen-based technology where you would write and then it will convert it into, and that's also because the doctor's writing, as you know, in everywhere in the world, not just India, is
Yeah.
absolutely pathetic, right? So that I think was pretty interesting. I think teleconsultation, I feel, has been quite a game changer, right? I mean, it doesn't allow you to go out, for minor things. I think that's, to me, has been like quite a great digital health win, if you may. Besides these two, if you ask me for a third one, I would say, um, I don't know if you would call it, digital, but it's, ambulances that are now intelligent, smart ambulances, where, real-time data of the patient is relayed to the hospital. Again, I met a startup that's doing it in Telangana only. So they have like a device that allows for the doctors in the hospital or in the emergency room to know what kind of vitals the patient's coming in with. And that, I think, is quite brilliant because that allows for a more efficient ER process, for it to happen. So yeah, these three, I think, out of all, to me, are like probably the best. Yeah.
Well, great. I think I would still debate on the first part, which is recognizing doctors' handwriting, how well it is. But the other two, I think, are things that are already happening. And as you rightly said, it's not as if nothing in digital health works. It's all works up to a point. But what do you think are the challenges in healthcare that are still there for a long period in time? I mean, it need not necessarily be in the digital health space, but just the so-called raw challenges in healthcare.
Yeah, so I think hospitals, the way they're run, whether they're, let's talk about private hospitals. I feel they are still run as businesses, right? So what happens there is that, there's lesser focus on the patient care process than the the more of like the business side of things, right? So I think I don't know how to change that, because a lot of these hospitals do get a lot of patient volume, right? So they are driving a lot of revenues, but what happens in that process is that it takes the quality of care away, right? um, a lot of private hospitals are also charging more, to cover up a lot of their costs. If they acquire expensive inventory, like new machines or new devices, they need to, break even for those, right? So they end up charging that. So that is there. The other thing is that the doctor-patient ratio is still quite poor. We still talk about it, but that really hasn't happened. And then I think definitely, if a patient in I know health is a state subject in India, but if a patient in Hyderabad has gone through a couple of consultations and processes over 4 years in Hyderabad and moves to Delhi, then they don't have the track record or history, right? They have to carry all their documents. And in the era of digital, we don't need people to be carrying folders, right? There needs to be that the health ID that's linked nationwide, right? I know health is a state subject, but at the end of the day, in India, people move around a lot, right? Let's look at the practical aspects of it, right? Like so, like I'm in sometimes in Delhi, I'm sometimes in Hyderabad, I'm sometimes in Bombay, and I want, if I'm seeing doctors in different cities, they should have the history with them. Yeah, and the same thing applies to the psychiatric care as well, right? Which is another area of there's a huge deficiency. There are only 1,000 psychiatrists in the country, which is nothing. I mean, think about it, right? So yeah, so these are some of the challenges I think I would say that we face.
Well, I think there's no dearth of challenges in our country, and definitely these are serious challenges. But given your experience in raising money, being on the commercial side of healthcare, at least with regard to the startups, there are challenges in the way hospitals economics also run. So we have this insurance, we have a large population which pays out of the pocket, but I think there has to be some kind of a creative mechanism to ensure that best care is provided, but also in a way that it really kind of doesn't hurt the patient. It's more like, as they say, treatment successful, but the person ends up being very poor, and it really does not help. uh, do you think there are any novel ways to finance this care?
Yeah, that's a very good question. I mean, I don't know if I'll have the answer right now, but I'm definitely happy to brainstorm as we speak here. It's a tough one because the general insurance system is not, I won't say it's broken, but it's not the most I would say equitable. I think that's a better word, I would say. And also the claims process and whatnot, it's challenging, the whole process. It's not the best. If one has to really think outside the box, one could look at some sort of a health incentivization based token based system, where you have these health tokens that are sort of managed again by a centralized authority. I mean, you could think of a decentralized system too. And then these tokens basically gain value as you are taking care of your health. And the other way to do it is also a community based system as well, right? So where a community pools a bunch of money or even a bunch of tokens, and then if someone is falling sick or something, then the community fund could also sponsor, a person's healthcare. So these are two areas which I've sort of at a very superficial level I've thought about. I've not done a deep dive into the health financing side of things.
Uh, but if you look at both, I mean, and if we extend the discussion, I think it would be investing more into prevention areas, because that's essentially what is health incentivization, where you are, undertaking certain activities which are considered healthy, but also they prevent the onset of disease conditions. And if you are doing it as part of a community, then you are actually creating a sort of a cluster cohort which also maybe carries out healthy activities, which several studies have shown that if you are part of a healthy cluster, then you also tend to become healthy. If you are part of a cluster or a social group that has poor activities or eats poor food, then you also naturally starts following. So I think uh, it's great ideas, but as you rightly mentioned, I think we need to brainstorm and see how to put the numerical values and numbers behind it, because money is numbers, and we need to quantify what you call behavior into numbers and see how to support it. You also spoken to several startup companies, both in India and in other countries, and you rightly mentioned that there's a kind of a level of innovation that I would also agree that we do lack. But the reason for that is maybe I wouldn't say no good labs in our country, but I'd use your term, which is inequitable access of labs to a lot of our startup entrepreneurs. So, how do we ensure that our startup entrepreneurs also get access to the best labs? Because at the end of the day, ideas need to go through this laboratory process where better looking outputs or much more valuable outputs come out of it, which also finds attractiveness from the eyes of the investor. So I think we all have great ideas, but execution or even researching further on that great ideas become a challenge. So how can we address that part?
No, absolutely. That's a great question. And also, I'll just add one more thing here, Dr. Suresh, is that, see, when you talk about healthcare, I think for me, I would take out tier one cities and metro cities completely, because I think here there are systems in place, and if you're living in cities, mostly so you have access to decent quality of care, and probably you can afford also that kind of care. I think if you look at India, India doesn't just live in cities, right? India lives in small towns and mostly villages, and that's the chunk of the population that still doesn't have the highest of care, quality of care. So I think as entrepreneurs, you need to think of innovative business models uh, based on both innovation, technology innovation, and innovation on the business model, on how to enhance the quality of care and service and delivery using digital in rural and the tier two towns and whatnot, right? Where it's not just an NGO based service, because you can't subsidize everything and run an organization. I mean, although I'm sure some NGOs will challenge me and they'll say, no, we have a great business model and we can also scale if you give us money. But all I'm trying to say is, because you asked me the question on how entrepreneurs in India who want to tackle health can tackle health, I would say you should look at those areas where the volume is high, but the value is low. So you're looking at a high volume and a low to mid value play, right? And your innovation has to be catered in such a way that the adoption also has to be there, right? It cannot be technologies that these guys will be hesitant in taking up, right? So whatever those digital technologies are, again, I'm speaking purely at a very high level, but I've met one or two startups recently who are in going into that space of tier two and rural healthcare with very interesting models where they involve a hub and spoke based system, and then they have like these smart ambulances that are running around, as I was telling you earlier. And I've just looked at their financials projections at a very high level. Again, I've not done a deep dive, but they seem to make sense. Yeah. So I would say that's where we should all look at, and portable diagnostics, something which I think already exists, like diagnostics that are portable, cheaper. AI for imaging is another area which is really taken off with the companies like Cure.ai and Nirmai and all these, right? Um, so all in all, I think focus on sort of the real India, if I would say, to the entrepreneurs with innovative business models and digital innovation.
Um, those are great ideas, Dr. Aman. Again, to focus more on the startups, how well is the IP ecosystem in our country? how well is the process of translating these great ideas into potentially business ideas? How well is the IP based value generation happening in our country?
Yeah, that's a great question. And the short answer would be it's weak, mainly because the defensibility is poor in India. You know, any any top innovation, usually you know entrepreneurs file it globally, USPTO in US and other countries and everything. But in India, if you have an innovation, it's very hard to defend it in India because you can run around courts and do whatever you want to say. At the end of the day, if someone has to steal it, then they'll steal it. So yeah, so the short answer would be that it's quite tough, from what I know, from what I've heard also from other entrepreneurs who try to patent their ideas. Yeah.
Well, you went through this experience twice, as you mentioned, working on clavulanic acid, which is now a widely prescribed antibiotic, especially along with amoxicillin. Uh, and also, you are part of one of the pioneers in biotechnology. So, and also working on cancer medicines, which again is now launched and is in the market. Do you think a similar experience is possible in India with the lab ecosystem that we have, or is it still work in progress?
So that's another great question. So in fact, I am actively not recruiting, but like looking at Indian biotech companies, and there is good innovation happening. I won't say to the level or scale as what's happening in the Western world or the global North, but the challenge here is really the patient capital, Dr. Suresh, right? You and I both know that innovation in India requires any kind of innovation requires a lot of capital, right? I mean, especially when hardware is involved or drugs are involved, or any kind of physical asset is involved, it requires multi-million dollar investment. So what's happening right now is that organizations like CCamp and all are doing a great job of incubating early stage companies up to 2 CR or 3 CR. But what is needed is the capital from 2 CR to 20 CR or even 200 CR, right? For taking your drug to the clinic for trials and whatnot. And that's where the gap is. And for some reason, our entrepreneurs are not able to tap into foreign biotech investors. And that's why we're not seeing that kind of churn in terms of a lot of like gene therapies or drugs or um, biologics and all coming out. But it's happening. It's slowly. There are a few good success stories that we're tracking, who've done well out of Bombay, Bangalore, and Delhi. And I think eventually a fund needs to come in that should back bioscience innovation to the tune of checks of 3 million, 5 million plus.
Yeah, that's true, Dr. Aman. Even what we have been seeing is, some time ago, which is not too long ago, maybe only 2, 3 years before, a lot of the startup companies would get only a couple of lakhs in money, and if you are very lucky, maybe 20 lakhs. But I think now, as you rightly said, 20 lakhs to 2 crores is reasonably possible. But again, one or two zeros are actually what it needs to be added. So from 2 crores to 20 and 200, I think if you are able to go there, that would really kind of create a very vibrant ecosystem here where this translation could actually happen. Otherwise, a lot of these things keep circling in the labs itself. So you have gone through this tremendous journey where, as you rightly said, you believe that all this multidisciplinary sciences is where work needs to be done, and then multidisciplinary work, not just in labs, but it has to be translated to the actual requirement, which is saving the lives of people. But there is a huge commercial element in the middle, or the economic element in the middle. So it's not just an idea, but it has to go through a long process, and a lot of things need to be understood if you have to survive in this ecosystem. And this is a bit challenging when we kind of say that students have to learn all of these things. And this is where, at Mallareddy Vishwavidyapith, we have started India's first school of digital health, where the idea is to bring in this multidisciplinarity and understand the broader picture, but also go into the nitty gritties on, the details that we just now discussed, whether it is digital health or, digital devices. It needs to be detailed, and then people have to know a few things. It becomes extremely challenging to teach this wide variety of subjects. And in your opinion, what are all the maybe top three skills that the students have to be taught?
Right. So I think definitely I would say around data, quality of data, data annotation, health, obviously, health data annotation. How do you classify data? So classification, annotation, and collation is one area. Definitely, I would say training large language models also after that. So LLM based training, how you can, you know, um, when you're collecting all kinds of data across, let's say, various districts and hospitals and whatnot, and you've solved the first problem of annotation, then how do you train models that can learn and better predict, for example, and be more intelligent health systems? So intelligent health systems, I would say, would be the other area. And I think if I have to talk about the third one, I think it should be something around health economics, Dr. Suresh. So maybe clever solutions on how digital could solve the laggard problem of insurance. So maybe some sort of hackathons could be run by your institute where new models could be brought in and tried, and pilots could be run on I just spoke about the token based system and the community based system, but more ideas. So yeah, so I think these three areas at the outset, I would say. And then also, if one more thing, Dr. Suresh, when I visited last time, I saw, and that could be done in partnership perhaps with a business school, right? So maybe ISB, or I don't know, some school partner with you and help these innovators, because I feel that is one thing that's missing in India in general. When you talk about scientists, is the knowledge of how to take your idea all the way through. Yeah, so not just through publication and just like good POC, but how do you go from POC, how do you raise funds? There's a whole art to it, right? How do you build network with this, how do you speak that language? So that I think could also be of benefit uh, to your students.
Well, that's great, Dr. Aman. In fact, a lot of people straight away go to this idea of data analytics. But as you rightly said, we need to start looking at how do we source data, and then how do we clean it up, and how do we annotate, because a lot of people assume that data is already there and all we need to do is like, download those Excel sheets. That's not the case in our country. We actually are looking at a very heterogeneous data set here, and a lot of original work needs to be done on standardizing the data, structuring the data, and then ensuring that it is actually cleaned up and good for analysis. In fact, that would be one of the key areas that the School of Digital Health will be actually focusing on, because there's a lot of diversity in our country. And as you mentioned, even if we walk through a hospital, uh, although a similar healthcare is provided in our country versus the West, the way that we actually provide healthcare is in a very different way. The numbers are very different here. The modes of data collection also needs to be very different here, and those are, a lot of them are original work that do not, as of now, have a standardized approach itself. And these are some of the things that we actually need to focus on. Otherwise, data is there, but it's just that we are not capturing it in a very analyzable way at all. The next thing that you mentioned is also very true. I mean, I think financial education is something that we need to inculcate to our students right from the very beginning. It's not just a great idea, but it's an idea that needs to sustain on its own and then become a business, and it has to be profitable, not necessarily to make money, but for the idea to sustain on its own, and then keep serving the population itself. So, how do we kind of specifically teach these ideas? I mean, can it be done through case studies, or do we kind of give them live experiences? You have mentioned hackathon as one of the options. Are there any ways that we can, kind of teach these skills to the students?
So, if you're talking about the insurance economics, or let's call it insurance innovation, I think a hackathon, Dr. Suresh, will be fantastic. Not just one, but like multiple in a year or something. Whatever, I don't know. I don't know the operational specifics, but the idea is really just to get brains from not just your institute, but your network across the country, get all of them to just come out and suggest, and then it won't take you long to get sponsors also. Venture firms can come in, private individuals can come in, and there could be an award for the best top three ideas, who can be invited to pilot it, maybe with the hospital itself, like your Mallaredi hospital, right? And that, I think, if that works out, it can be a national exercise done by your institute, and could be solving one of the biggest problems in the healthcare systems. One of the biggest problems, which is insurance, right? The economics of care. And the other one around the financial education of students and scientists, I think that's not I think you can introduce a module where that module is run by a business school, and that just is focused on, and you can get people like me and others who have gone through the journey to do lectures and sessions regularly, online or in person, but an ongoing thing. And but this is primarily for those who are building out ventures, right? So I mean, those who are interested in pursuing academia, it's okay. But those who have interest in pursuing entrepreneurship and innovation, they really do need this, education, especially from people who have been through the journey. And yeah. So you could run that as like an ongoing course.
Well, thank you for your suggestions, Dr. Aman, and also thank you very much for volunteering to speak to our students in the near future. So, I think these are some of the areas that we can actually collaborate and see how to take our collaboration even further. I will definitely engage with you on fine tuning or perhaps like brainstorming our ideas. As I mentioned earlier in the conversation, we want to kind of create this so-called unified platform of data sourcing the life course of a human being, not just his physical data or his medical data, but also the genomic data, again, of not just himself, but also the so-called touch points in his life, and create something as a normal, I wouldn't say, I mean, like continuing pathway, but a long life as possible, as much as possible pathway that we can come out with. And also, I think you would definitely require your expertise with regard to framing the course content, as we just now discussed, and maybe organizing this hackathons also. So it's been great talking to you about your life course and
Pleasure.
all the experience that you have had, your views on digital health, and also in what ways that we can actually teach our students all these great ideas. Any kind of takeaway ideas on any schools or any institutions that are already doing this, that we can consider them as best practice institutions that we can hopefully follow or copy?
There are numerous around. I would say there is Cambridge University runs this course called MPhil in Bioscience Enterprise. So, that's a course they run for individuals who have some science background, science and technology, like undergraduate degrees, and then they can do masters through this program. And I know a lot of alumni from this course who are all doing really well in sort of the bridging the gap between sort of science, basic science, translational science to the commercial. Besides that, I'll look into it more. I'm not coming on top of my head, but I think there are almost every major city in global north has university has some programs for that. But I'll also say that you are at the perfect stage here, Dr. Suresh, where you have the ability to drive a lot of these amazing things we discussed today, right? Like I feel that we're all there, we all to support you in your sort of mission to drive change in through education and digital health and healthcare revolution in the country. But definitely, happy to be involved as we go. Feel free to always reach out, and happy to brainstorm on calls or in person when I visit. And yeah,
Well, thanks a lot, Dr. Aman, for the support and your wonderful help as always. It's always wonderful talking to you.
same here.
I always tend to learn a lot when I speak to you, pick up a lot of new things,
Same here.
especially with your discussions. So it's been fantastic talking to you. So let's keep in touch and stay in touch. Thank you.
Thank you so much. Thank you. Take care.